Hello everyone, and welcome back to the third section of the webinar. In this section, I'm going to be talking about policies and practices that we have in place to help support fellows by focusing on a particular group of issues with host family apprenticeship and community, medical incidents, security incidents, spotlight on drug and alcohol policy, and addressing behaviors. So the first area I'd like to focus on are times when fellows have issues with their host family, their apprenticeship, or their community placement. And it is not uncommon for fellows to get to their new host family apprenticeship or community and to have feelings of nervousness, discomfort, culture shock, or general anxiety. And sometimes they'll contact staff and ask to be moved to a new site. They think something is wrong. And if health or safety is at risk, we will address the situation immediately. But if health or safety are not at risk, and this is actually an appropriate and necessary challenge, we'll coach fellows in strategies to address the challenge. Fellows commit to stay in their site for 1 month before making a change. And that's because their perception of the situation often changes as they become more familiar and comfortable with their surroundings. So if after 1 month the issue persists and the fellow has made a good faith effort to overcome, then we will consider site switches on a case-by-case basis. And another thing to note is that fellows should always feel able to bring up challenges in their host family or apprenticeship with their team leader. That is exactly why their team leaders are there. And families, you can help by encouraging fellows to do this if they are having an issue. The next area I'd like to focus on is physical and mental health incidents. So fellows will get sick. Hopefully they won't get sick often or seriously, but it does happen. And team leaders and health and safety managers are there to help. Our staff have been trained and we have emergency response protocols in place that guide the staff in how to respond to various types of incidents. We encourage fellows to contact us staff when they're not feeling well. We don't want them to suffer in silence. We don't want them to suffer alone. And you families can also help us by reinforcing this with your fellows. In case of an emergency or any kind of medical issue, fellows should call their in-country emergency hotline or staff directly first. We go over this with fellows during in-country launch, and the fellows also receive a hard copy of the emergency response plan. So please encourage your fellows to always communicate with Global Citizen Year staff first in case of emergency. In case of an incident, we will encourage your fellow to keep you informed of what's going on with their health. For incidents of a moderate or more serious nature, our staff may also contact you to let you know what's happening and how it's being managed. We really aim to respect fellows' privacy and also families' concern for their fellows' well-being. And so we will always confer with fellows prior to informing their emergency contact regarding an emergency or a non-emergency incident. In situations where the fellow is unable to make a decision, such as in a case of extreme injury or illness, we will contact the primary contact on their behalf. And for fellows who are under the age of 18, primary contacts will be notified in the event of any emergency. And of course, parents and guardians can always reach out to us in the US office anytime for more information or questions or concerns. And we'll go over the contact information at the end of this webinar once again. Sometimes fellows will experience serious changes in their underlying health condition due to new environmental factors or the stress of being in a new place on Global Citizen Year. And the health and safety of the fellow is always one of our top priorities. And if these changes impact the fellow's ability to meet the essential eligibility criteria and participate safely in the program, we will consider temporary or permanent separation. We'll be in close touch with parents in these situations. It's always our wish that the fellow can complete the program, and the final decision will be made by Global Citizen Year based on medical professionals' diagnosis and our experience and knowledge of the Global Citizen Year program design. This is why the medical screening and clearance process that's taking place now in the summer is so very important. The more we understand about any pre-existing health conditions that the fellow has, the more we will be able to support them in establishing and maintaining a management plan to stay healthy while in country. And we encourage you and the fellow to be forthcoming with us in the medical screening process. The next issue I wanted to cover is security incidents, and specifically sexual assault. So the Me Too movement over the last couple of years has really highlighted the problem of sexual harassment and assault that's taking place on campuses, in various industries, and across society in general, both within the United States and across the world. Within universities in the United States, 23% of female undergraduate students experience rape or sexual assault. Along with universities and other educational organizations, we are very concerned with this issue. At Global Citizen Year, we have had incidents of sexual harassment and assault of fellows in the past. And while we've not experienced these incidents at the same level as on university campuses, we take them very seriously. In recent years, we've augmented our existing personal safety training for fellows with additional training meant to raise awareness and reduce risk of sexual assault. And so, for example, during the summer before departure, fellows are required to complete health and safety exercises, including watching a series of videos to raise their awareness of sexual harassment and assault, as well as to set the tone and common expectations around healthy relationships. Fellows also receive training during both global and country launch on strategies for responding to sexual harassment that they may experience within their communities, and specific steps that can be taken by fellows to enhance their security. This includes policies, such as the drug and alcohol policy that I'll discuss in a moment, that are in place to prevent fellows from being in especially risky situations. Throughout the year, there will also be additional check-ins and refreshers to empower fellows and help them respond to situations that they're facing in their communities. So what happens if something happens? Unfortunately, even taking all of these steps cannot fully guarantee that sexual harassment or assault will not occur. Fellows will be briefed during launch on what they should do and can expect from Global Citizen Year in case they or someone they know experience an assault. Global Citizen Year staff have all been trained in a survivor-centered approach to responding to sexual assault, and we have detailed protocols in place for how to best support the survivor when a sexual misconduct incident takes place. As part of this, Global Citizen Year offices have identified medical, mental health, legal, and law enforcement resources in each country. Respecting the privacy and confidentiality of the survivor is a core part of best practice and our approach. And in case of an incident, we'll encourage the fellow to share with trusted allies when they're ready as part of the healing process. If a fellow is 18 or older, it will be up to them to decide whether, what, and with whom to share. This is a difficult issue that all young people in this age group are experiencing, whether they go to college, participate in a gap year, or do something else. And we encourage you to talk with your fellow about this and about staying healthy and safe on their gap year in general. Okay, the next topic I'd like to focus on are health and safety policies with a focus on the alcohol and drug policy. So by now you should have hopefully read and signed the policy handbook. If you haven't, please check with your fellow because it passes through them first on its way to your email inbox. And the policies described in the handbook are all in place to help keep fellows in their stretch zone where they can learn and grow, while recognizing the risk profile of our program, that space in the Venn diagram that we looked at earlier, where the fellow and environment risk factors overlap and amplify each other. Policies such as the drug and alcohol policy, motorcycle, and extreme sports policies address specific and real risks to fellows' health, safety, and their ability to learn that also do not add any benefit to the fellow learning objectives. We highlight the drug and alcohol policy because this is one that fellows most often push back against. Due to the design of the Global Citizen Year program, which is, again, high independence, low supervision, unfamiliar context, drugs and alcohol are not a part of the program. The presence of drugs and alcohol vastly increase the risk of crime and assault, and in no way contribute to the learning outcomes of the program. Use of drugs or alcohol also demonstrates poor judgment and decision-making in a context where we rely on fellows to be responsible and reliable partners in preserving their health and well-being. So fellows who drink alcohol or use drugs while on Global Citizen Year put themselves and other fellows at risk. And it's for these reasons that fellows who drink or use drugs are subject to dismissal. We recognize that fellows may hesitate to report emergencies where drugs or alcohol were present out of fear of being dismissed. And so there is an amnesty policy in place to encourage fellows who are in a health and safety emergency, such as being in imminent physical danger or being the victim of sexual misconduct, to contact staff for help without fear of being dismissed due to those policy violations. And there's more information on the amnesty policy in the policy handbook. The last policy area that I wanted to cover is addressing behavioral issues and consequences. So global citizen behavior is the touchstone for how all members of the Global Citizen Year community are expected to interact with each other. And it applies to fellows, staff, partners, and really everybody in our community. Global citizen behavior supports fellow health, safety, and well-being, and keeps fellows in their stretch zone, where they're learning and growing, and out of their panic zone where they are not. Fellows who behave in a way that violates GCB threaten their own health, safety, and well-being, and that of those around them. And violations to GCB include things like not upholding any of the policies in the handbook, acting culturally inappropriately or disrespectfully, or violating the laws of the US or the host country. When behavioral issues emerge, our team addresses them using a restorative approach. And the goal of this restorative approach is several. It is to address the real or potential harm to the community that resulted from the violation, to provide a space for those involved or impacted to have their voices be heard, to increase our capacity and commitment of all involved to take responsibility for both the intent and the impact of our actions, to repair the harm that was caused, and to increase the level of trust and accountability required for the rigor of Global Citizen Year. When responding to policy violations, our staff are trained to use what's called a 6 A's protocol. And this protocol guides staff and fellows through a progression of steps that address the behavior and achieve the restorative goals that I just mentioned. Out of this, there's a number of different interventions that can take place, and those include things like restorative circles, behavior contracts, action plans, home, family, parental involvement, removal or separation from Global Citizen Year activities. So for example, reducing or removing entirely independent travel days and privileges. And finally, up to and including dismissal from the program. In the event of a severe or repeated breach of our values and standards, fellows may be dismissed from the program. In case of more serious violations, we will be in touch with parents to inform you on what is happening and to seek your partnership in addressing the needs of the fellow that are leading to the behavior. We expect and hope the best from and for all of the fellows, and hope that none of them gets into a situation where the consequences of actions leads to dismissal. And by educating you and the fellows in advance of the reasons behind the policies and potential consequences of violations, we hope that we can prevent any of these types of dismissals in the upcoming year. So that's it for the policy section. The next and final section will be about your role in supporting your fellow.